From the RSNA, I'm Dr. Yana Ivanidze, and this is Radiology Imaging Cancer. We are back in your feed with a very special podcast episode featuring Dr. Toma Omofoye, Associate Professor at MD Anderson Cancer Center in Texas, and renowned Global Health Education Scholar, among many other qualifications you will hear about. Dr. Omofoye recently received the RSNA Helen C. Redman, MD, and Marten F. Klop Education Scholar Grant, which recognizes and will continue to support Dr. Omofoye's important work in global health education in radiology. Our featured host this time is Dr. Xiaoyang Liu, a member of our trainee editorial board and an accomplished abdominal radiologist at the University of Toronto. I hope you enjoy this podcast episode, and as always, we look forward to your feedback. Also, as always, you can find more information in our show notes. Enjoy the interview. Be in Chicago for RSNA 2022, Empowering Patients and Partners in Care, where the biggest week in radiology inspires professionals and industry partners from around the world. Be engaged with more than 400 educational courses and scientific sessions from every subspecialty. Be inspired by more than 500 exhibitors featuring the latest technology, demos, and industry presentations. Join us in person, virtually, or both. Register now at rsna.org/register.
Thank you very much for joining me for this Radiology Imaging Cancer podcast series. My name is Xiaoyang Liu. I'm an abdominal radiologist from University of Toronto in Canada. It is my great pleasure to welcome Dr. Toma Omofoye from the University of Texas MD Anderson Cancer Center in Houston. She is a breast imaging radiologist with a special interest in global health and education. She is the Strategic Director of Education in the Department of Breast Imaging at MD Anderson and has been involved extensively in radiology education initiatives in many countries such as Tanzania, Singapore, Ghana, and Nigeria, where she was raised and born. This is just to name a few. Thank you, Dr. Omofoye, for joining us today.
Thank you for having me.
First of all, congratulations on receiving the 2022 RSNA Helen C. Redman, MD, and Marten F. Klop Education Scholar Grant. This is a very prestigious award for someone like you, who's dedicated in global education, teaching radiology students and residents. So could you please tell us a little bit more about your project, which won this prestigious award? And if you could tell us, how did you get interested in this project? And what is the root of your strong interest in global education?
Well, hello. Thank you so much for having me. As you mentioned, I am very passionate about global health education. I am honored to have received the Helen C. Redman, MD, and Marten F. Klop Scholar Grant Award for our project, Development of a Customized, Interactive, Web-Based Global Breast Imaging Curriculum with Self-Assessment for Radiologists in Low and Middle-Income Countries. Dr. Helen Redman was the first female president of RSNA, and receiving an award from her foundation for this project to improve breast health in African countries highlights the potential impact of female radiologists on the advancement of women. I know it's a whole mouthful, but my collaborators and I, Johnny Vlahos and Baranga Mini at MD Anderson, basically have developed this customized curriculum for breast imaging that's focused on those who are practicing in low resource areas in low and middle income countries. And why did we do this? Well, breast cancer is the leading cause of cancer death in low and middle income countries, and its incidence continues to rise. In fact, we know that over the next decade, 70% of breast cancer cases will be diagnosed in low to middle income countries. And when you keep in mind that these countries already have much poorer outcomes from breast cancer treatment, poorer survival, there's a real risk of broadening health inequities. And so the importance of addressing breast radiology is one that has been on the forefront of those who are practitioners in LMICs. So, for example, the radiologists in Nigeria over the last few years have developed the Breast Imaging Society of Nigeria to try to increase interest in people subspecializing in breast radiology, learning some more of those techniques so that they can work towards early detection. The issue is that for a lot of these countries, for example, Nigeria and Zambia, they don't have subspecialty trained instructors themselves. So the instructors are sort of self-taught, have accumulated knowledge from their, hands-on practice over the years, but haven't necessarily themselves gone through a formal radiology training program. And when you are a radiologist practicing in a country where there is such a need for physicians, the amount of responsibilities on your plate are so vast that education can be something that kind of falls to the wayside a bit. For example, in Nigeria, there are around 300 known radiologists, and the population is over 200 million individuals. So the need for the radiologists, the volume that the radiologists are experiencing is so significant that educational support is something that these radiologists have identified as a critical need. But what we're doing in this grant is really taking a holistic approach. So it has three components. We're creating a customized online library of lectures. So this is tailored to the kinds of resources that they have in low and middle income countries. So the material matches the infrastructure. We're also developing self-assessment testing for the learners using confidence calibration. And then we are enacting monthly virtual meetings using Project Echo, which is a telementoring model for didactic and hands-on case-based discussions. We came about all three of these components, the online library of lectures, the self-assessment using confidence calibration, and even the monthly telementoring by feedback that we receive from radiologists that were practicing in these countries who have identified that these are some of their critical needs. They wanted the lectures, but wanted it to be comprehensive and they wanted it to be relevant. They wanted self-assessment because we know that recall, right, is the way that we can most demonstrate increased retention of learned material. But with confidence calibration, we're not just giving them multiple choice options to guess among. What we're doing is saying, not just tell us what you think the disease process is in this picture, but also tell us your level of confidence, which helps us assess their confidence as well as their competence. So we're very excited about doing that. And then doing this monthly telementoring allows us to connect not just with the learners in other countries, but also connect the learners to each other so that we can share difficult cases, we can discuss practice management opportunities, and really kind of grow a community of people who are practicing in a similar resource environment to provide the best care possible to impact global breast cancer.
Wow, that is very, very interesting. It's really amazing to see how this new technology has bring us to everything to, like you mentioned, telementoring, materials online. I think it's a great project, a great effort that you are making, especially I think this will give a lot of impact on the low income and developing countries where, like you said, has very limited resources, especially in terms of teaching materials. I really admire what you will be doing for this project. And I think internationally it will have, for many years to come, really a huge impact on the radiology learners. So I really hope it goes very smoothly for you. And
So too.
now, would you foresee any difficulty along the road of conducting this project? This is a very international. Probably you need a big team on board. Any difficulty you might potentially encounter, and how would you like to solve it?
I will tell you that, yes, in our experience, we've had now the opportunity as a team to work on a smaller scale version of this project, which we implemented in Singapore. And yes, the process of implementing something like this does come along with difficulties. I'll say in that project, which we were doing in Singapore, we did not have the sort of funding that we have in this instance, which is protective. It gives a lot of time to be able to dedicate to it. And honestly, educational projects do not have a lot of opportunities for funding, which is why it's so wonderful that the RSNA R&E Foundation is willing to continue to invest in education, especially international education, in this way, because for educators, it's wonderful to have the opportunity to dedicate time for all of the other troubleshooting that has to happen. I'll say that some of the difficulties that we've encountered and maybe that we anticipate here is that it's important to go in and to be curious. When we initially published our research about the educational project that we had implemented in Singapore, we had radiologists from many places in the world reach out with interest in participating, which was wonderful. But we found that we could not just assume that you could take a one size fits all approach to it and just take one package and just implement in a different country. So I think one of the things that we have to be aware of is that practices are heterogeneous, and we have to ask a lot of questions to figure out the differences between each place. What are some of the things we need to look out for? Who are the players that we need to get involved? Where do we get buy-in? What are the implementation potential potholes that we could run into? So really paying attention and asking a lot of questions from people is important. Making sure that we know what's been tried, what do the individuals identify as their needs. Sometimes people are, in an effort to be really polite, will not communicate with you some of the needs that they have, but really trying to build enough of a relationship and rapport to have a clear idea of their needs is important. One thing that's interesting in global health projects for anyone who's participated in them, nowadays, a lot of the institutions in low and middle income countries have collaborators abroad, either in the US or in the UK, but they may not forthcoming with that information. You may not know that there are other people who they've been working with on other projects. So you have to be clear about what other commitments they have with their time and with their infrastructure and such to make sure that all of this continues to align in a way that helps their institution move forward. And it's not just about, the US or UK or Australian or whatever European institutions coming in and implementing their own goals and timelines at that facility. So overall, I think, time and cultural humility and being curious rather than making assumptions are very important.
Yeah, we would definitely bear these things in mind in the future if we were to establish any global mentorship or educational task. Like you said, cultural diversity, dealing with so many different countries. This is quite inspirational what you've done and what you've told us. Absolutely. So, with all these passion, we could clearly see this tremendous passion you have. When you talk about these projects, your eyes just shine. So, can you tell us how do you initially get interested in this, in the global education, and what is your motivation out of everything you did?
That's a really good question. And I'm smiling a little bit because I'm trying to decide if I should share this story or not. But I'll tell you. I'll tell you. So, I was born and raised in Nigeria. I didn't move to the U.S. until after I'd completed high school. But one of my earliest memories, I think it's a memory, or maybe my family just repeated it so much it's now legend. But when I was about 2 years old, I was in Nigeria. I was in the care of my aunt, and I ran away to school. And her house was across the street from a school or something, and somehow she may have turned her back to do laundry or something, and I crossed the street and I went into school, and a kindergarten teacher found me and took me into their classroom, and that was it. I started school. So I wasn't the kid who ran from school. I was a kid who ran to school. Education is something that I've just always loved as far back as I can remember. I loved being around books. My closest friends were the librarians in every school I ever went to. The process of learning was just always very interesting. And there is an African proverb that says, "He who learns teaches." And what that means is certainly that when you learn, you're excited to teach what you've learned to someone else, right? Learning just makes you excited to teach. But it also means that when somebody learns something, they have taught the other person the right way to teach that thing, right? So it's a relationship. the process of one person learning creates in the other a teacher. And I think that when I, went into medicine, there was just so much information to learn. And I quickly realized that the process of teaching any of it helped me to learn it a little bit better. So I loved learning, and as part of learning, I started teaching so that I could learn more. I learned better how to communicate more clearly, and I'm always trying to communicate more clearly and more effectively, but I also love how it's so relational. So much of what we do is about being in relationship with our patients, with our referring providers, right? All of that is what we need to practice, and education, I think, straddles all of that. So I just kept pulling on that thread of learning and education, and really the Latin word from which doctor is derived is a word that means to teach or the teacher. So the role of being a doctor to me is sort of inseparable from that of a teacher. So I've always wanted to do that. And as somebody who was born in a different country, I had this really unique experience because I was born to two physician parents, but I was born in a place with very few physicians. In fact, for most of my life, my mother was the only female physician that I knew. I have this memory, I think, when I was about in second grade, I moved schools. I was in a new class and I had to stand in front of the class and introduce myself. And all of our parents were part of the same community. So you said your parents' name and what they did. And I stood up there and I said, yep, my mother is such and she's a doctor. And none of the kids believed me. They said, nope, she's a nurse. Your women cannot be doctors. Your mother must be a nurse. And they're like hazing me as I'm standing in front of the class. Now, that's a traumatic first day at school. Um, but, it just made me realize how unique my experience going through the world was. And so I paid more attention to what she did and how she lived. And what I realized was that every interaction that she had, she used it as a teaching opportunity. Whether we were out in the stores, she's kind of a community physician, everybody knew her in the stores, or if we were at the clinic, she was a teacher. And so my entire experience becoming a physician myself, I just always had that sense of responsibility of, how can we help people get the information that helps them improve their health? Because you improve your health, then you can consider improving your life. And so seeing her practice in a, country that had some areas that were very low resource, I think it was just always at the back of my mind that as much as was within my power, I would want to contribute as well. And I'm an academic radiologist today. And one of the wonderful things about MD Anderson, where I work, is that they have a global mission. They have sister institutions all over the world where we have the opportunity to partner with people and teach. And as much as we love to teach patients, as much as we love to teach the trainees, it's so wonderful when we can teach at every aspect of the continuum. When we teach the teachers, that really propagates the work that we're doing in education. So I think in some ways, global health education is wrapped up in a lot of my identity. It's part of who I am as an immigrant. It's part of who I am as, the eternally curious big reader. It's part of who I am as somebody who's very relational and communal.
Mm-hmm.
Basically, I had no choice. This is what I was going to do.
That's also what makes you unique, right? A very
I guess
unique
so. Yes.
childhood. Your mother, very lucky to have a mother like that, right?
Yeah,
Who's inspirational
absolutely.
for you. Yeah, absolutely. With your background like this, you've seen developing countries where there's very limited resource. You were trained in medical school and radiology residency fellowship in the U.S. You've seen both sides of the world, to put it that way. Can you give us a little bit insight on why is global health so important, especially for people who haven't been able to get the exposure on the other side?
Yeah, now I'm going to speak from my African part of my background. For many years, Africa and a lot of developing countries have suffered from a brain drain where the trained healthcare personnel and trained personnel in many fields, migrate out of the continent to practice in higher income countries. That's gone on for many, many years. And that contributes to increasingly poor health outcomes and poorer understanding of disease. But we have to keep in mind that when there is a brain drain out of Africa or out of other continents, that affects us wherever we are because there's a loss of information. So, in breast cancer, for example, data has shown that some of the subtypes and genetics that we see in breast cancer in West Africa may more closely mimic the kind of breast cancer genetics that we see in African Americans in the United States. And one thing that we know is that the African Americans in the United States have really disparate survival compared to non African Americans in the United States. So, what information could we get from this data out of West Africa that could impact people from similar backgrounds all over the world, right? So, when we lose information from certain continents or certain countries, we're actually losing that everywhere. So, there's really an importance in maintaining our connections and helping every country be as elevated and as productive as possible to continue to contribute to our work in eradicating cancer. More and more US trained physicians are indicating that they want to be part of the brain gain. They want to be part of the people who are able to contribute heavily to African healthcare, building careers that kind of straddle low and high income countries. You see more and more trainees, even early in the process when they're medical students, will reach out and say, I'm interested in global health. How can I get involved? Which is wonderful. I think that that's going to be a growing career track where you'll see people continue to straddle both countries. And I think that the more that we invest in global health, we can develop pathways that allow people to give their best to more than one place, which I think is just really exciting.
Mm-hmm. Yeah, that's a very interesting perspective. You know, being education is on one side, and also getting information from those limited resource places is also important. As of now, everybody moves everywhere.
Exactly.
There's a lot of people from different places. All of these are helpful for the better being of the human beings, right?
Yeah, and for a long time, radiology was slow to global health. In fact, that was one of the reasons I hesitated about choosing radiology was because I thought I wouldn't be able to contribute to global health. But now we see the advantages that we get with progression of technology. We can do Zoom lectures from anywhere in the world. You don't have to get on a plane and fly to go and do that. You can do this in this way that's much more sustainable and reproducible, right? So, as technology continues to advance, we have the opportunity to contribute to global health in a sustainable, consistent way. So, I actually think that there will be a growing cadre of radiologists in the next generation that will be global health radiologists, maybe not in education, but in other ways.
Absolutely, and you definitely find your niche there in radiology.
Yes, yes.
So we've talked a lot about your work, your educational passion, and global health. I know you have some other passion that we can talk about, which is your gorgeous family and your three lovely children. As a female radiologist, in particular, I'm very curious about this as well myself. With so much dedication to your clinical work, your educational tasks and initiatives, how do you approach your work-life balance as a mother?
Well, you have, in some ways maybe uncovered all of the secret places now. The truth is, the answer is probably not well, right? How well do I balance work life? Probably not well. But I've taken a different approach to it. I don't really approach work life balance anymore. I think more of integration. In general, parenting taught me to be really efficient initially. So it was just get through the clinical workload as quickly as possible so you can get home, be really efficient. But as I wanted to develop more and more passions and pull on these strings of being able to contribute to global health or research or anything else, I realized that efficiency really wasn't enough. If I was going to be efficient at work, but there were still other things I wanted to do, and then say, oh, I'm at home now, I have to close the laptop, I can't work at home, I would feel like something was missing. Um, and so I really approached the idea of work-life balance. I read all the books. I remember one book that really stood out to me was when I read 4,000 Weeks, Time Management for Mortals. It's just a really irreverent look at time management and efficiency. But one of the big takeaways, the average human lifespan is terrifyingly, absurdly short. It's like 4,000 weeks. Um, so adding stress about how well you prioritize things is not necessary. Like the first thing you have to take off the table is the stress about how well am I doing things. That's actually just wasting more of your time. So I just learned grace, to show myself more grace and to show that to my kids and to show that in the teams that I'm on as much as possible. And then to try to value collaboration as much as possible. Let us multiply our efforts by working together. And so, with any part of any project, I'm always asking, okay, what are your strengths and what are your strengths and what are your strengths? So each of us are kind of prioritizing that. But I also had to embrace that I can't do everything. So it's good to say no to the things that won't feed my soul. So I think earlier in my career, I probably was more, um, I was involved in a lot more different things. I had fingers in a lot more pies. And now I have fingers in a lot of pies that are kind of close to similar flavors, okay? It's really becoming very niche. In some ways, it means that you get to become more efficient because you know some of the tried and true techniques, but it also is because these are the things that feed me. These are the things that are inspirational to me, that are exciting to me, the things that I'm happy to talk with my kids about. My oldest is 7, but I talk with them about what I'm doing and why I'm doing it and why it makes me happy, and then I don't feel guilty about it. So they don't interpret it as something to be resentful of. They're not resentful of my work because it's a part of who I am. So it's all really integrated. And if I'm deliberate about what parts of this work I think I can do at home and show my kids at home and stuff like that, I'm doing it much more freely and thoughtfully than if it's just coming out of a sense that I just couldn't finish it in the number of hours that I had in the office. It's been interesting for me because more recently, one of my children was diagnosed with sort of this chronic episodic illness. And so it's also shown that, time is not guaranteed. At any point at work, I could get called that, I got to go pick up my kid from school. They're not having a good day. Um, but that means then that I'm also very deliberate now about creating good memories at home too. We don't know if we're going to have a good day or not. So on the day when we're having a good day, where everybody's healthy, we can infuse really beautiful memories into the mundane. So we have all kinds of silly, rituals and traditions. There's silly traditions about how we say goodbye. There's silly traditions about how we hug. There's silly, traditions about each person getting their day where everyone has to do everything they say, but all of that helps to make me feel that we're building a lot of beauty and intentionality into their childhood, so that it's not so bad if I work late one day or if I'm on call the other day, because they have lots of memories to choose from that can feed their souls as well. So I don't know if I'm doing it right, but my goal overall is to try to minimize guilt and just maximize the time.
Thank you for sharing this very touching story. I'm sure your children are actually very proud of you, and you are a great role model for them. So,
You're very kind. You're very kind. Thank you.
so thank you, Dr. Omofoye, for spending this time and sharing with us, your genuine stories, your personal stories, and your experience on the educational work. It's really been incredibly humbling to hear all of the journey you've gone through. I hope our audience also obtained some inspiration from your experience. Now, on behalf of the Radiology Imaging Cancer Editorial Board, I would like to thank you sincerely for taking this time for us.
It is my pleasure. I'm so grateful for all that you all do. I have enjoyed listening to many episodes of the podcast, so this is quite a treat for me to get to see behind the scenes here. So thank you all to your team for making this possible, for this wonderful opportunity. And I hope that we continue to cross paths as more of these projects come to fruition.
Absolutely. We're looking forward to that.
Wonderful. Thank you so much.
Thank you.
This concludes today's episode. I want to thank Dr. Liu and, of course, Dr. Omofoye for this fascinating discussion. I sure learned a lot about Dr. Omofoye's work in improving postgraduate radiology education in low and middle income countries. I also want to thank Dr. Omofoye for so candidly sharing her experience and expertise, both as a physician and scientist in radiology and global health, but also for sharing her personal experience as a Nigerian American and her immigration story. If, like me, you were inspired and would love to learn more about this topic, be on the lookout for an editorial by Dr. Omofoye, soon to be published in Radiology Imaging Cancer in the next several weeks. Thank you all for listening, and we look forward to your feedback via email or on Twitter. I'm Dr. Jana Ivanice, and this is Radiology Imaging Cancer. Thank you for listening.